what are we going to talk about? Just a little bit about the presenters, a little bit about the Muslim Jewish Forum, the impact of COVID-19 specifically on Muslims and Jews and their propensity to get it, some of the immediate challenges the community is facing, and then 5 and 6 are basically discussions which Jonny is going to moderate. And this presentation is being recorded. Afterwards, the presentation, but not the group discussions afterwards, will be published on the Muslim Jewish Forum website. And the reason why we're not recording the discussions afterwards is so that people can speak freely without feeling that whatever they say is being recorded for posterity and published to the entire world. Because, of course, whatever goes on the Muslim Jewish Forum website is visible to the whole world. So, the presenters. Very briefly, I'm the co-chair of the Muslim Jewish Forum. I've been involved with it since 2005. And I'm a retired tax advisor. Jonny is also one of the people who's been involved with the forum right from the very beginning and was co-chair from 2007 when our first Jewish co-chair, Henry Gutterman, died, until 2015. He's also heavily involved with many other voluntary organisations, including the Jewish Representative Council for Greater Manchester and Region. So, the Muslim Jewish Forum of Greater Manchester. Muslims and Jews are very different communities in the UK. There are about 10 times as many Muslims as there are Jews, and both communities originally immigrated to the UK, but at quite different points in time. The major Jewish immigration was well over 100 years ago now, during the period 1880 to 1920, although of course people have come here since. The Muslim community in the UK is much more recent, and particularly over recent years, as people have come from different parts of the world, it's an ethnically very diverse community, whereas most Jewish people in the UK are of European origin, with some now of Middle Eastern origin. There are many things that Muslims and Jews have in common, and in particular things that matter to them vis-a-vis their relationship with the rest of the community. And we have 9 fundamental principles in our statement of principles at the Muslim Jewish Forum. For example, both Muslims and Jews eat meat that's been killed in a particular way, and quite often there are attempts in the UK and indeed in other countries to try to ban that. We care about faith schools, we care about circumcision, and we care about rapid burial, and don't like post-mortem examinations that are intrusive. And the basic theory behind the forum is very simple, that Muslims and Jews can defend and pursue these common interests much more effectively if we do so together than if we do so separately. And in our Constitution, our Memorandum of Association and Articles of Association, we set out a mission which is very geographically focused on Greater Manchester, about bringing Muslims and Jews in Greater Manchester closer together, and also conveying to the wider community an understanding about the things that matter to us. And I want to give one example of how we have done this particularly effectively. And this is not actually a Greater Manchester issue, it's a national issue. In 2015, the British Veterinary Association promoted a petition which, after about 9 or 10 months, had got over 100,000 signatures. It's the second petition in this list, just below the red box. End non-stun slaughter. Jonny Wineberg got in touch with me and told me about this petition, which I was previously unaware of, and we organised a counter petition, which in those days a petition could only be in one name, and it was in my name, but Jonny had written the first draft. And because the Jewish and Muslim communities, not just in Greater Manchester but in the whole country, actively circulated this petition, we got our 100,000 signatures in just over 9 days compared to 9 months for the vets. And I think that's a particularly good example of Muslims and Jews working together. And we'll see another one later on in this presentation. So moving on to COVID-19. First of all, I'm one of these really pedantic guys that likes to get names right. And I looked at the World Health Organization website. The virus that is attacking us is a virus called SARS-CoV-2. And if it infects you, the disease that you get is COVID-19, and it should always be capitalized like this. So I'm very interested in the question of who's getting it, because it doesn't hit everybody equally. And there is some very high quality data which we're going to look at, which tells us about COVID-19's impact by sex, ethnicity and health status. There's less reliable data from newspapers about Muslims and Jews, which we'll also look at. So first of all, looking at the reliable data, there's a body which I've previously never heard of, the Intensive Care National Audit and Research Centre, which gets data from intensive care units all around the National Health Service. And they've issued at least 2 reports, because I've looked at both of them, on COVID-19, and the data that we're going to look at in a moment is from a very recent report issued on the 10th of April. And you can download it from this link, but I'm also going to put a copy of that full report onto the Muslim Jewish Forum website anyway. I don't think there are any serious copyright reasons why I shouldn't do that. And page 5 has some really interesting comparisons of COVID-19 impacts, and because these medical researchers wanted something to compare it with, they looked at viral pneumonia over the years 2017 to 2019 to see what differences there were. Because of course, COVID is a virus disease affecting the breathing system, and so that there are some similarities with viral pneumonia, but also many differences. And we're not going to look at the fine print of this chart, but there are just a few things that I want to pick out and look at. First of all, there's no religious data at all in the report. The nearest we can get to religious data is to look at ethnicity. And this chart looks at the categories of white, mixed, Asian, black and other, which are the categories available in this report. And the impact, the incidence of COVID-19 compared with viral pneumonia and with the local population. Because if you say that 20% of people have COVID-19, well, what was the local community like? If the local community is all white, that's one thing. If it was all Asian, that's entirely different. So they have tried to match this at census ward level on local communities. But the graph isn't very informative, but they've also published a spreadsheet with the detailed numbers behind this graph, and they are much more interesting, or much more informative. And what we see is that, looking at viral pneumonia, for example, white people are overrepresented with viral pneumonia, because in the local population, 75% of people are white, but 88% people of viral pneumonia patients are white. And that is a function of the white British community being relatively old, I think. And I put 2 numbers in red to focus on them. If you look at COVID-19, you'll see that 14% of COVID-19 cases in intensive care are Asians. Now, that compares with a much lower incidence of viral pneumonia. Now, 14.4% doesn't look very bad compared with a local population share of 12%, but actually it is. The reason is that Asians tend to be much younger on average than the local population. So you would expect their incidence of COVID-19 to be much lower, because elsewhere in this report, and I haven't got the numbers from about age, I deliberately left them out to keep this presentation short, it shows that COVID-19 is very, very strongly age-related in terms of making you seriously ill, needing intensive care. Similarly, with the black community, that is a very high ratio, 11.9% of intensive care patients being black compared to only 6.8% of the population. And again, the black population, particularly black Africans, are on average much younger than people who are white British. So looking at Asians as the closest approximation we can get to this in this data to Muslims, it's quite clear that serious COVID-19 cases are much more prevalent amongst Muslims than they are amongst the white population. There's no Jewish data you can pull out from this report at all. It just doesn't try to categorize that. I also had a look at the previous health status, and the key message here, I'm not going to go through the individual diseases one by one, is that while viral pneumonia, these existing diseases are reasonably heavily represented, they're much less represented in severe COVID-19 patients. So the COVID-19 people in intensive care were actually much healthier before they became ill than viral pneumonia patients. Being healthy does not guarantee the same level of protection against COVID-19 that it does against viral pneumonia. Now, moving on to the Jewish community, I subscribe to the Jewish Chronicle, and very early on I noticed when they were publishing numbers of Jews who died from COVID-19, how much higher that was than the percentage of Jews in the population. So, for example, this story on the 27th of March, at that stage, nationally 759 people had died, but there were 34 Jewish deaths. It's 4.5%. But Jews are only 0.5% of the population. Now, I have seen various attempts to explain this. For example, the Jewish community is heavily concentrated in London, which is where the big first COVID-19 outbreak was, but I don't think that's enough to explain it. The Jewish community is quite a lot older than the Muslim community, and it's a little bit older than the white British community, but not so dramatically older, in my view, as to account for the difference in the death rate. More recently, on the 8th of April, the Jewish Chronicle published an updated number for deaths, 152, by which time there were just under 9,000 deaths in the population as a whole. That 1.6% is still 3 times the Jewish population share. Now, one thing that could account for that is that the Jewish figure includes deaths outside hospital, whereas at the moment, these government figures only include hospital deaths. And when they are updated for deaths in care homes, deaths in the community generally, maybe it will become less disproportionate. But at the moment, I think even though firm numbers may be slightly flexible, I think it is clear that the Jewish community is overrepresented with COVID-19 deaths and with serious cases than the community as a whole. And we saw earlier that Asians are definitely overrepresented. I haven't seen any hard data specifically for Muslims in the media, but one of the things again that caught my eye was that of the first 10 named doctors to die, all 10 of them came from black and minority ethnic backgrounds, most of them Muslim. And everything I see on social media about the incidents in the community suggests that Muslims are getting COVID-19 in a seriously bad way and dying in a much higher proportion than their population share. And I know that politicians are now starting to ask questions about what can the government tell us about why the minority groups are getting COVID-19 more. As I said, the ICNARC data for Asians definitely implies a greater impact with Muslims. One theory which many people have expressed is multi-generational households, where you've got children, parents and grandparents living together. Because children tend not to get COVID-19 in a really bad way on average. Not everybody. Sadly, we've had a 13-year-old who's got COVID-19 and died, who had apparently no previous health conditions, but that is quite rare. But children who bring it home, giving it to the parents, or if parents are going out to work and bringing it home, and if there are grandparents in the house, it can be lethal. And multi-generational households are much more common amongst Muslims and amongst Haredi Jews, I think, than they are in the population as a whole. Now, again, scientific proof of this is quite hard. While it's intuitively obvious, the disease is so recent, research is still being done, numbers are still being collected, and I've seen a couple of competing research papers, one looking at different countries in Europe and particularly looking at the incidence in Italy, trying to say that yes, multi-generational households must be a factor. Another paper seeking to rebut that. I'll put those papers on the website, but I didn't want to take up space in this presentation for them. Moving on to immediate challenges, one of the biggest issues facing both communities is having large numbers of people die in a short period of time, particularly because both Muslims and Jews want to bury quickly, and both communities were very concerned about the government's original plans, which when the government's just passed the law, the Coronavirus Act 2020, giving itself all kinds of special powers. This is where the special powers come to fine you and arrest you if you leave your house, for example. And in there were some proposals about cremation that Muslims and Jews found particularly worrying and unacceptable. And there was strong concerted lobbying, which again demonstrates the importance of Muslims and Jews lobbying together. And changes were made to the Coronavirus Act, and I'll just show you the wording in a moment. In terms of burials, again, cemeteries are responding. This morning, my wife showed me on television a short extract from the news where there were 10 Muslims being buried in effectively a long trench. Each person was getting an individual burial. The prayer was being recited and they were being buried and not cremated, but the people doing the burials were dressed in protective equipment. These are the times that we live in, but at the moment there's no sign of the burial system being overwhelmed, but everybody is still concerned. This is just I'm not going to read this out word for word, but this is the Schedule 20 of the Coronavirus Act, paragraph 13, where this is the version where the government has responded to our community concerns, because the authorities must have regard to the desirability of following the wishes of the deceased, or if the person's religion is known, following the views of that religion. It's not an absolute guarantee. The government can't make guarantees. If the whole system was utterly overwhelmed and there was nothing they could do, they would cremate. But the law now is that they must bend over backwards to allow proper burials of Muslims and Jews rather than cremating them. Passover, we're in the middle of Passover at the moment. There were many electronic seders. I know that Heather Fletcher, my co-chair at the Muslim Jewish Forum, for example, she attended an electronic seder from her house, because that is the world that we live in today. And initially mosques were reluctant, some of them, to close, although the Muslim Council of Britain was very fast at putting out a recommendation to the whole country for mosques to suspend communal prayers. And with Ramadan coming up, I think virtually all mosques will not be having communal prayers. They have realized that no matter how unsatisfactory it feels, the preservation of life has to come first. So with that, that's the end of my sort of presentation. I want to hand back to Jonny Wineberg, to lead us through our sort of collective discussion, etc.